Hey, it's Dr. Josh here. So today we're going to talk about some strategies to manage swelling. So this is most effective for areas like elbows, knees, ankles. Those are going to be the most common joints that are going to get really swollen that you could sprain or strain, or that there could just be some chronic degeneration or damage that's causing those joints to swell up. So I'm going to go over the 4 things that you can do to help manage that swelling. And we'll talk about some supplements that can be helpful to also deal with the inflammation that can cause swelling in these various joints. So the first thing we want to focus on is compression. So during the day, right, I understand people have to work. One of the best things that we can do when it comes to compression that we can wear is going to be a sleeve. So they make sleeves that'll provide some slight compression for elbows, for knees, for ankles. Wearing those throughout the day is going to be helpful, especially if you sit a lot at work. So sleeve is a simple solution that you can wear all day to provide some compression so that that joint space doesn't fill with so much fluid, right? We don't want to compromise that joint space. We want to try to keep it as with as much space as possible. So wearing a compression sleeve can be really helpful. Another thing you can do is just a simple exercise band, right? These provide the ability to where you can wrap your joint, right, your elbow or your knee or your ankle, and you can wrap it, you can wear it loosely like around the house, or you can wrap it really tight and provide a ton of compression to a joint. You only want to do that for like a minute or so, and if you do end up wrapping it really tight and providing that compression, you can try and kind of move the joint around too. And then when you take the band off, you'll get a rush of blood flowing back into that tissue and just kind of flushing things out. So that's a good strategy that you can use. But again, you don't want to wrap it tight for more than about a minute or so. So wearing a compression sleeve is going to be one of the easiest ways to provide compression. Second thing we want to do is elevate. So again, people have to work. You can't just lay all day with your leg up, with your arm over your head. But we can take a minute, 2 minutes, 5 minutes out of the day and elevate whatever area needs to be decongested, right? So just throughout the day, try and get some elevation. It doesn't matter if it's only for a minute or so. And when you get home at night, then you can elevate whatever area needs to be elevated. You can do that for an extended period of time. So we want to compress, we want to elevate. Third thing we want to do is apply some heat. I like a heating pad. Do it for about 15-20 minutes at a time and take 15 or 20 minutes off. So I like heat over ice when it comes to chronic injuries. So studies have shown that ice will decrease the permeability of lymphatic vessels. What that means is so all swelling gets decongested through our lymph system. Right, so we need our lymph system to be flowing. We need nice open pipes. And if we put ice on a swollen joint, what happens is the surrounding lymph vessels actually they close up, right? So ice will cause things to constrict, and it will constrict those lymph vessels, and we'll get a decrease in drainage of swollen tissue. So I like heat more than ice. You can use ice some if you need to, but always follow it up with heat to help dilate those lymph vessels to decongest any swelling, right? And the fourth thing that we want to do is we want to decongest whatever joint is swollen. And the only way that happens is through muscle contractions, right? So our lymph system is like a big pump system, and the only way that fluid gets pumped through it is by muscle contractions. So one of the easiest things that we can do that is low impact that can to help decongest our tissues is going to be biking. Biking is super simple. It's very low impact. You can bike as long as it's not painful. Another strategy that we can use is an EMS device. EMS stands for electrical muscle stimulation. So there's a bunch of different devices out there. There's like the Mark Pro, there's the Complex, and then on Amazon you can just get like a $30 EMS device. It'll come with pads, and you just place the pads above and below the tissue that's swollen. That's a good strategy. You can wear those for extended periods of time. So we want to focus on getting some type of muscle contractions to pump out any swelling in a joint. All right, so those are our 4 main strategies that we can use to help manage swelling. There's a few supplements that can be helpful. I like curcumin and boswellia. They're both pretty strong anti-inflammatories. There are compounds that have these supplements all in it. My favorite is Inflamamed. If you need it, just shoot me a message and I can send you a prescription on FullScript and you'll get my discount with that. Another tool we can use is collagen powder. Now that's not an anti-inflammatory, but just anecdotally I have patients that have taken it and found that it helps their joint pain, their joint swelling, joint inflammation. Another supplement is CBD. CBD is all the rage these days. It's not magic, but it does have some anti-inflammatory properties and it does have some pain-killing properties. So the combination of these can be effective. So this is our strategy to manage swelling, and it's really effective. You can do it every day and it will help to get your swelling under control. So I hope that provides some insight. Head on over to HansonComplete.com if you have any more questions. Have a good one.